Next up is going to be muscles of the back. Now we're going to talk about the two separate layers. There's extrinsic and intrinsic. We're going to start with extrinsic, and then we're going to identify within each of those layers what their attachments, actions, and innervations are. So extrinsic basically means the superficial components that you can see visibly on the back. And if we look at the complexity associated with the muscles of the back, you're going to see that when I exploded here, there is a huge amount of dynamics going on here. So we're going to work first of all to identify these posterior aspects and make sure that we get those solid before we start moving into the more complex intrinsic components of these muscles of the back. Let's start working from posterior to anterior. So we've got the deep fascia of the back. Next we're going to look at the three different fibers of the trapezius. We're going to also then talk about the lats and work our way to serratus and to the posterior layer of the thoracolumbar fascia. Below the deep fascia of the back, we're going to come across the superficial layer of back muscles. The first is going to be the trapezius. There's going to be descending, transverse, and ascending fibers. We'll go into those more in a bit. Latissimus dorsi is also going to be in the superficial layer of back muscles. Then we're going to talk about identifying the levator scapulae, which is going to be a little bit higher up in the compartments, and then rhomboid major, rhomboid minor, all of these of which make up this superficial layer of back muscles. The intermediate layer is next, which pretty much just comprises of the posterior superior serratus and the posterior inferior serratus. These muscles attach to the ribs and are contributors to respiration, whereas the other extrinsic muscles contribute to motion of the extremity. The superficial muscles are innervated by the dorsal scapular nerve and the accessory nerve, and you're going to get some arterial supply that's going to come down from the deep branch of the transverse cervical artery. One point I want you to observe here is there's going to be this triangle of auscultation, which comes between the lats and the trapezius, and we'll be coming back because that's an important part for physical diagnosis. It wouldn't be complete if I didn't talk about the dermatones in the back. These are the superficial nerves on the skin that will relate to nerve roots, and we'll go over those in more depth when we get into the spine. All right, so motion. This is retraction and extension of the upper extremity, and you can see the superficial muscles of the back are big contributors here. There's your rhomboid major and rhomboid minor that are helping with this. Your lats are also going to be, particularly as an extension. And then, of course, above, you're going to have all three layers of your trapezius. They're going to be major players in retraction and extension of this upper extremity. Other motion is going to involve elevation of the scapula. A lot of these superficial muscles in the back have great impact on the scapula. You can see that the levator scapulae, of course, is a huge contributor here. And we're seeing some of the fibers of your trapezius. This is the transverse fibers here that's elevating. Above that is going to be the descending fibers and the ascending fibers. Other motion is going to be pulling the arm and the scapula down. Here's the lats doing that. And here it is after abduction. The lats are adducting, pulling the arm back down. And of course, when it contracts, it's going to internally rotate that humerus as well. Bottom line, superficial extrinsic muscles move the extremity. Some landmarks here. You can see that we've got the descending, transverse, and ascending fibers of the trapezius marked. And then if you stay on that left side, you're going to see the erector spinae muscle. And below that is going to be the dimple for the superior iliac spine. Here I've marked again between the traps and the lats is going to be that area of auscultation, that triangle of auscultation that you're going to use to listen to the lung from the posterior aspect. Let's look midline from top to bottom. You got the nuchal groove, which below that is the posterior median furrow. The nuchal ligament runs down that line. It's kind of the mohawk of the back, if you will, between the spinous process. You're going to have at the shoulder level, the C7 spinous process, and then down low on either side, you're going to have the erector spinae muscles, and below that's going to be the posterior side of the sacrum and the intergluteal cleft. Landmarks on the right side of your screen. Medial scapular border is going to be right there alongside the rhomboid. You're going to have your lats coming around, and again, between those is going to be that triangle of auscultation. So let's make sure we're clear on our learning objective here. This time we're just doing extrinsic muscles. We want to know about the attachments, the actions, and the innervation. I did go through those muscles pretty quick, so let's go over them one more time, and then I'll wrap it up by giving you a chart that summarizes all this information. Here we go. Traps up high. Then we're going to move down low. Lats, rhomboid major and minor, serratus, posterior, inferior, superior. That's going to have us find our intrinsic muscles. And then we're going to come back out. There's your serratus again, rhomboid major, minor, lats, and traps. All right, I can hear you already. So what matters? Well, here's a chart that's going to help you with the extrinsic muscles of the back. Note there's the superficial and the intermediate group. Know what muscles are in those groups. Probably more important to understand the innervation from the traps come from the cranial nerve, and the rest is the anterior rami of the spinal nerve. And then know that their function is to control the limb and assist in respiratory motion. The intermediate muscles, their job is more to help with respiration. We will focus on some of the origin insertions as we need to when we progress through different courses. All right, guys, this has been Dr. D. Hopefully that gives you a good overview on extrinsic. Let's talk about intrinsic next.